Hello, everyone. We will go ahead and get started just to respect all of our time. It is 1:05. So first things first, I'm Georgina LaFoe. I work at Wichita State's Community Engagement Institute, otherwise known as WCUCEI, a lot of acronyms. And I am so happy to see you all. I am beyond grateful for the time that you spend to come here, to drive here, to be here. To me, that shows your dedication in what this stands for. So I'll kind of rewind it because we have new people too. We have familiar faces and we have some new people as well. So what is PreventionWorKS? PreventionWorKS started out as a coalition for coalitions. And in that case, it was for those coalition members to gather, collaborate, and work on sharing resources. And throughout the years, that has become a little bit more open so that community members and other people who are interested in prevention can participate. And so that's why I'm so happy to see all of you here. So you don't necessarily have to be in a coalition to join, and I love that. So thank you. The main purposes of PreventionWorKS includes five different I don't want to say topics, but five different pieces that are integral to PreventionWorKS. And those include connection, voice, synergy, empowerment, and integration. And so that's going to be our goal throughout today and any prevention works that we have throughout the year. Those of you who are new, we do have 4 of these events per year. This will be our first one this year. Go 2025. Let's see what we can get done this year. I'm super excited. But until then, today's topic is going to be advocacy. And so many of you know there's Advocacy Day tomorrow for our Kansas Prevention Advocacy Day. And today's going to be a big training piece in that so that we can prepare ourselves and know how do we even approach advocacy? What is advocacy? How is it different from lobbying? And all those kinds of questions that might start to come into your mind. Without further ado, I'm going to introduce our first speaker, which is going to be Yvonne Stroman from our lovely partners at CADCA. So she flew all the way from DC for us. So I'm very, very grateful for her. And she is going to teach us about advocacy and give us all the deets on what that looks like, how it feels, how we can set it up, and just kind of propel us into what it truly means to be an advocate for prevention specifically. And so can we give a round of applause for Yvonne Stroman?
Hi, how's everybody doing this afternoon? I want to thank you for allowing me to come in your space and talk with you a little bit about prevention, right? From a perspective of advocacy, talking about what advocacy is, what it is not. And then also, I think part of our advocacy work, we have to talk about something that we should all be familiar with, but I just like to talk about it for the sake of talking about it, and that's called leadership. So let's kind of get into it. Oh, I also want to just say, if you have any questions, I don't pretend by any means to be an expert. I just know that I've done a couple of trainings and done some literature and that type of thing. But I also know that oftentimes when I come into your space, that you're experts too. So I invite you to please share what you know. If you have any questions, I'd be more than happy to have that discussion. And then if there's not anything I don't know, I'm going to be honest with you and say I'm not really sure, but I certainly will find out and I will get back to you with the correct information. Probably Georgina and I will have a conversation, and that's probably my mechanism for communication. So our time together, I'd like to start off by talking about leadership and what does that mean to you? Because quite frankly, leadership can look like and feel like different perspectives. And so we want to invite you all to think about leadership as we dive into talking about advocacy and then how advocacy actually turns into policy. And then I also kind of want to talk about what's the difference between advocacy and lobbying, because there is a difference. And then I often find that in this work, it can be tiring when we're going through it by ourselves, but if we can collaborate with our partners, identifying who our allies are and how do we network with them? How do we conform that kumbaya so that we can go after what we're looking to see differently in our communities together? How many youth are in the room? Under the age of 70, right? Right? That's all of us, right? That's what youth means. Youth is kind of a euphoric meaning that means sometimes, depending upon literature, they say 18 and under. But right, oftentimes in other countries, they say be under the age of 25. I dare say it's under the age of 70. So we have youth in the room, right? And I just kind of like to start out talking about some of those ideas when we're talking about working with youth, right? Because when we have the opportunity to work side by side with young people, our potential to see creation, to see changes become very different. Why? Because we asked them at the table to join us. And so I just found these couple different quotes and want to invite you to kind of think about them with us and what they might mean in the way of our own youth. The youthful enthusiasm is the spark that ignites motivation, right? And so oftentimes when we have ideas about something, it perhaps stems from when we were younger and how we want to see things different for our own young people today. And so we sparked by that motivation for change. We're sparked by that motivation to change them and the way that they think and behave, particularly when we see them going down a road that might not be in their best interest. And I oftentimes, even now, I have an older sister who says, well, when I was younger, I don't say that, but she says it. When I was younger, and she talks about being a perspective of being younger. And so that motivation of change can be there. And then the other thing is talking about youth is the canvas upon which the masterpieces of tomorrow is painted, right? So we tell youth oftentimes you're leaders of tomorrow. I dare say I switch it up a little bit and talk to them about leaders today, because tomorrow isn't promised to us. But when we can take action today for change, it's an opportunity to be something great down the road, right? Empowered youth are the catalyst for change. And then the fire within the hearts of youth lights the path to a brighter future. And so it gives us the opportunity to ask young people, what's on your hearts and on your minds? What are you thinking about your world in the way that it is now? And what do you want to see different, right? And even ourselves as adults, we're in this room. And I always, when I do trainings, ask, well, how many are in it for the money? How many are in it because you know that tomorrow you're going to be a millionaire, right? How many are in it because you know you're going to make, $500,000? And so we know that our passion is not necessarily driven by the financial resources, but by the resources that we see in each and every one of us and the resources that we see in our young people and even in our community. That's what we tap into. That is our passion, and that's what drives us. And so I always start leadership by talking about something that's called the social ecological model. In all fairness, I am a teacher. I do adjunct teaching at one of our universities. And so I always like to go from a perspective of just kind of laying down the foundation, right? And so the social ecological model is a theory that we're all connected. And we're all connected based on 4 levels: who we are as individuals, right? And then those relationships that we develop. And those relationships that we develop within our community that ultimately impact our society. So we're not in this alone. And that's really what I like to underscore, is that as we think about leadership, as we think about trying to make change through advocacy and information, that we're not in this in our own little silo, and that we have the opportunity to expand change from a broader perspective. Because what can affect and impact me, we can share that so that it impacts everyone else and it becomes infectious. I think I'm going backwards here. That's not what I want to do. I apologize about that. And then I kind of just lay the foundation of talking about leadership in the perspective of the 7 C's of leadership. Now, this is something that I actually train young people on in terms of laying the foundation about what leadership is and what it isn't. And so this model comes out of UCLA in the 1980s when they were talking about the social ecological model. What they were saying was that there are actually 7 characteristics that can impact someone's ability to be a leader, right? And so I just kind of want to quickly go through these. And you might ask, well, why are we talking about leadership right now? It's really because in order to affect change, we have to see it happen before we can actually go after it. And part of that means there are aspects of ourselves that we have to put forward in order for that to happen. For example, when we think about leadership, right, and these are reflective, it can come down to who am I? Who am I as a leader? And then there are aspects under that leadership that talks about consciousness of self. And when I talk with young people and even adults, having that value of inside internally of knowing who we are helps us to identify what does that mean for us? What are different policies that are out there? What do they mean for me personally? And how can I communicate that, whether I agree with it or not? And the reality is that there are some policies that are in our communities that really affect us in a great way, and some maybe not in a great way. I was talking with my good friend Russell, and he was like, sometimes we come into buildings and they're really not handicap accessible, or they're really not handicap friendly. And so we talked about this room, right? And so even in that realm, do we want to try and make something better for somebody else? What is our consciousness of self talking to us about that in terms of how far do we go? Because if it's really important to us, right, we're going to make some comments about that. If it's not, then we say it's an observation and let's move on. But that consciousness of self really drives about us and really makes us up about who are we and what do we stand for. And then that congruence talks about, do my thinking and my behaving and my actions actually synergize, right? So that people know who I am and what I stand for. And not only do I know that, but people can see it as well. And when I talk with people about that, that congruence even means that to the degree that if somebody says something about you and it maybe not be in a good light, that others who know you know that that's not even possible, because that's just not who your makeup is. That's not who your DNA is. That's not who you projected out there to be. So the opportunity to be congruent is to speak up on something, to be passionate about something, and that it resonates with everybody knows that that's where you're at. And that commitment really just talks about, am I all in? Am I all in towards this advocacy thing, towards this policy change, despite naysayers, despite the time that it takes, despite efforts of just being, refuted time and time again, right? And so when we think about that, we kind of think about this all talks about in the way of leadership, who am I? Who am I when it comes to my space and place in the world, how I interact with others, and what does that mean for me and my community? And then when we talk about, this thing has a mind of its own, I'm convinced of it. Then when we talk about collaborative, now remember, we talked about the social economical model talking about relationships. And so in those relationships, how well do I work with others? Am I collaborative, right? Am I willing to work and hear other people's opinions despite the fact that I might disagree with them, right? Is there a common purpose? Are we all walking together in the same frame and same light? Do we understand that this is the goal, right? How we get there might be a little bit different, but we're still after the same goal. If we're trying to, if I'm correct, Kansas doesn't have any marijuana laws from what I was reading, but there is some conversation about medical marijuana, right? And so in that, we might have people who have opposing views, right? But if we're trying to say that's something that's not necessarily Kansas is ready for, how do we talk about that? And so people might have different values or opinions about how we talk about that with our legislators. But if that's the common goal, we have to appreciate all sides of the table being able to come with their information, right? With their facts, with their stories, right? And understand that that's our common goal. At the end of the day, we don't want legislation bringing forward medical marijuana, right? And so how do we work well with others? Do we get up from the table when we hear something we don't like, right? Do we say, I've ridden my hands up this all and I'm just going to do this on my own? What does that look like? And then that controversy with civility is so important, because controversy with civility really speaks to honoring opposing views and moving forward in a fashion that says, I still respect what you're saying, right? Controversy with civility is really that action that says, above all else, whatever we might say to one another, we're still going to hold each other in high esteem, and what our opinions are really matter across the board, so that all voices are heard. Everyone's input is valued, and no one feels demeaned. And then finally, it talks about societal values, all right? And that's stretching that ecological model to say, it all comes down to how will I create a better world? And so societal is about working from a perspective of what you all are thinking about today in terms of how do we push forward those values that's meaningful for everyone, right? That's meaningful for everyone. And how does that ultimately uplift Kansas to be a great state that it is in terms of drug-free, healthy communities? right? Now, usually I go through this pretty quickly with young people, but I kind of break it down one by one so they can kind of ingest it. But because of time, I just kind of want to say those are the 7 C's and then ask the question, maybe, right? We can see that the change is in throughout, that they can, oftentimes somebody might ask the question, well, which comes first? Kind of like the chicken or the egg. And I will say they can begin anywhere. Sometimes people are collaborative and they find out that through their own collaboration, they're able to develop a consciousness of self, right? Or sometimes people might say this is very valuable, right? In terms of the society. And I think about, during COVID time, at least in our community, where young people really felt that there was still a need for families to be fed. And they volunteered their time to go to the food bank in a safe way, getting that food and distributing it back in the community. From a societal level, they saw value in that. And within that, they found their own consciousness of self. It raised some awareness in them that perhaps otherwise they would not have had, and allowed them to be collaborative with others, right? And so I share this to kind of say, in terms of change, it doesn't matter where you start, right? I just say we start somewhere and we let that grow. I'm just wondering here in our room if anyone wants to, I think there's mics that you can talk or speak up as we kind of put a bow on this leadership. And has anybody ever thought about this before in this way of context? And as you're listening to it, do you have a characteristic that you feel like you possess really well versus a characteristic that you're working on to acquire? And I'm just going to leave that there and see what we get back. Thoughts?
I think for me, the easiest thing is the more intimate, like individual relationships and building community through that sort of format.
Okay.
And from that, I've seen how connected we all are, how much in common we all have, and I'm working toward community organizing, learning those skills and how to connect the people that I've all grown to love, who
Absolutely.
think that they're different, but they're not.
Yeah. I appreciate what you're saying there. I have a conversation with my sister often. She and I are pretty close, not only in age, but she's one of my closest friends. And then there's sometimes when we talk about values, we're at this restaurant, and her tip is, it's okay, but I say, I base it on the service that we get. And so let's do 20-25%. She looks at me like I have 3 heads. And I said, but wouldn't you, if that were you in exchange and you were a waitress, wouldn't you want that as well? I mean, you're doing everything that you can for that customer. You are going above and beyond. They're checking in on you. Wouldn't you want that? And so it's just kind of a perspective when you talk about we are reflections of each other. Like, wouldn't you want that for yourself, right? And so, in terms of that individual value, I try to share that just in terms of saying, at the end of the day, of course, you're going to do what you feel you need to do, but without that extra information, could we possibly do something different? And so we have an opportunity to be reflections of not only our young people, but other folks in the community who may otherwise not have this information or feel that they should be speaking up or could speak up. And so we can be their voice. And that's really where our values as a collaborative can really come to life. Anyone else? Thank you.
As you were speaking, I think I resonate a lot with a lot of them, especially like the individual values, congruence, commitment, that kind of thing. When you came to controversy with civility, I felt like 8 years ago, had you talked to me around that, I would have agreed. In today, I struggle with that far more because I feel like we're disagreeing on things that I hold so deeply to my identity that it's not that easy.
Yeah. Thank you. That's that, and that's deep, and that's really where that because we're going to have controversy. We know that that's part of our world. It's that civility piece that really underscores and is underlined to say, can we disagree in a spirit that we still can be heard, right? And it still move forward in the best light of what's in the best interest of everyone, not just the chosen, not just a couple. Yeah. Thank you for that. Thank you for that. And so sometimes when I'm talking with young people, I say, you know, do we have to have all 7 of these characteristics? No, no. And the reality is 2 things, is that we can grow. I mean, it's progress, not perfection. And so we can identify. So my question is, what areas do you not necessarily think that you possess, but you would like to acquire more skills in being? There's that question, right? And understanding that we are in progress of growing, right? And then as a collective, we all can share these 7 together, right? Anybody thinking about area that was just, I thank you for the controversy with civility. Any other area that you might identify to say, I could do a little bit better? I could perhaps extend a lifeline to somebody, right? Any thoughts about that?
One of the characteristics that I know I need to sharpen is this. Trying to listen to all different perspectives.
Okay.
And it's not that I shut them down. It's, you say
Turn it off.
something, my mind's already going to what I'm going to say next instead of
Mm-hmm. Thank you. I'm with you. I do that, particularly when sometimes we possess that idea that we're right and we know we're right. And so I'm going to listen. I'm going to tell you that I'm listening, but I'm already at the end. I'm guilty. Guilty. Right. Thank you. Anyone else? And part of this is about that vulnerability, right? That we know that there are things that we can do to improve ourselves as a collective to be better, right? And thank you. And because quite frankly, we don't get the message sometimes that it's okay to disagree. We're either right or it's wrong, and there's no in between, right? And so when we think about that consciousness of self, we're talking about our own survival. We're talking about our own self-preservation. And so as part of that self-preservation, I'm right and the world is wrong, or I'm right and you're wrong. And so I've got to preserve what I know to be my own. And we call it self-preservation, we call it integrity, but we're really conditioned to be on one side or the other. And what I love about the social ecological model, it tells us that we all are connected, that there's a relationship that has the opportunity to be built for all of us so that we can all thrive and survive together. And so the idea of silos and haves and have nots really isn't part of the social ecological model. It's really working together on an even level. So I appreciate that. Thank you. Thank you. Any other thoughts? Yes.
So one of the leadership characteristics that I think I possess is like collaboration. So using the power of we versus I. So like when I'm speaking about something or speaking about like my team that I work with, if I'm in spaces where it's just me and no one else, I still use the words we versus I can do that. So really incorporating my entire group. That way, when it ties back to the socio-ecological model, showing that the collaboration of we has more powerful meaning than just I, because in groups, you build more versus individuals.
Yeah. The team of we talks about the opportunity for all of us to have a shared responsibility, right? And the team of we win, right? And so I appreciate that collaboration. Absolutely. Thank you all. And so when we're thinking about leadership and we're thinking about it in the context of change, right? How does our leadership, how does the work that we do, who we are, how does that elevate into policy? And so we know throughout our time in history, there has been movements, right? Whether it's the women's rights movement, whether it's HIV and AIDS movements, whether it's now the mental health movement, right? There have been movements that have really come about as a result for policy change through advocacy work, right? And so there are different levels of advocacy. There's that self-advocacy, right? There's that individual advocacy on behalf of somebody else, right? And then there's also systems advocacy. And all the advocacy works together in terms of education and raising awareness and informing. So I want you to think about a time when you wanted a rule or policy to be changed or improved. And this could be anything from a personal level in your home to in your workplace to in society, right? So I want you to think about a time when you wanted a rule or policy changed or improved. And what did you want to see changed or improved? What was that specific thing that you want to see changed or improved, right? If I can give an example, like, since in my work, in my day-to-day work, people have the opportunity to now to work from home, but there really isn't any policy. You just ask. Like, you could just be granted, like, the plumber's coming, so I need to be home, and you can work from home. But there's nothing consistent. And I've asked, like, is there something in writing that we can refer to? Because Jane and John just willy-nilly take it because it's there, versus some who don't take it, myself, because I don't see any policy about that. So I would like something in writing, but it's pretty loose. It's just kind of ask your supervisor, and if they're feeling generous, yes. If they don't, then no, right? So what did you want to see change or improve? Who did you need to talk to about that change? Think about who did you need to talk to, right? And then what was the information? What was the content of information that you needed to communicate to that individual? How did you present the information? Was it through, I was getting ready to say Skype, but we don't do Skype anymore. Was it through, tells you how old I am, right? Was it through email? Was it through text? How did you present that information? And what was the response? What was the response that you got? So I'd like you to kind of take a couple minutes, right? You guys didn't really think I was going to do all the talking by myself, right? What did you want to see changed or improved? Who did you need to talk to about that change? What was the content of the information? And how did you present that information? And what was the response that you received? So I'll give you a couple of minutes to kind of think about it. If you need to jot down, please feel free to do so. Okay, well, let's move on then. And maybe during a break, if you think about something, you want to have that conversation, absolutely. So, and I share that to just kind of say, it started out with a piece called advocacy. It started out with a piece that you had some information, you wanted to share that information to promote some type of change to happen, and you advocated for that in a way that really resulted in something favorable, right? And so when we think about advocacy, it's a word that's oftentimes thrown around, but really what is it? So let's kind of talk about the definition. So advocacy is any action that speaks in favor of or recommends or argues for a cause, supports or defends or pleads on behalf of others, right? Advocacy includes education and creating awareness among legislation and the general public on issues facing the community and the importance of aligning policy to address those needs, right? And so, as I said, advocacy has been with us throughout our history, right? I talked about women's rights, I talked about mental health, I talked about HIV and AIDS, but we know that there's been a lot of advocating moments in our history that has created policy as a result of that. There are different types of advocacy. So I wanted to just kind of mention, because I think it's important. When we talk about working with young people, right, sometimes in our quest and in our desire to work with young people, we share with them, we bring them along. I'll use the example of underage drinking maybe, right? There's an outcry because of the number of accidents that young people are getting into. And so we want young people to rally around on underage drinking. And we bring them into our fold, into our coalition work, and we kind of present to them because, underage drinking, marijuana, vaping, as those areas because of grant purposes or because of that's what we see or because of that's what data tells us. And I wanted to share this, and I apologize, it's not really that clear, so I'm going to tell you what it is. I asked my good friend Russell, when he had a meeting with the young people in the month of January, prior to me coming and doing this, I said, ask them what's on their hearts and their mind as it relates to social issues, right? Because sometimes we tell them what their social issue is, but do we really connect with them and they give us that feedback? And this is really what they said. They're concerned in our communities about bullying and inclusion. They're also concerned about community empowerment or the lack thereof, right? So sometimes young people see this as a space and place where they're not being seen and not being heard. And how can they gather themselves to promote community empowerment? They also talked about they're concerned about social media I'm assuming social media in the way that it's being used. And sometimes social media, as we know, can develop into harm, right? Where young people are being bullied on social media. They also talked about community engagement and perhaps how can they find out more about community engagement, or perhaps overall what they're seeing is there's a lack of community engagement. They also talked about peer pressure. They talked about mental health. They talked about desiring safe space for the LGBTQ. They're also concerned about national minimum wage, right? They also are concerned about adequate health care. They're concerned about stigma. They're concerned about social standards, youth leadership, abandonment, poverty, inflation, right? So what I found really, really interesting is that young people really are inundated with a lot of social issues now more than ever, and it's weighing heavily on their minds. Much to the degree why mental health, we see it surfacing more and more among young people today because they're just overwhelmed with a lot of different social issues. They're connected with a lot of different social issues, i.e. homelessness or unhoused, which is the most appropriate term I'm to understand. They're concerned about, minimum wage. Can their families afford food, right? Can they afford the roof over their head, right? And so all these concerns can be overwhelming to young people. And they're trying to find their space and place to say, well, how do we communicate this information in a way that can promote change? That something can change whereby the spaces and places where they're living and growing up are a little bit more safer. And so when we talk about advocacy and why this is important, is because it's really broken down into two categories. There is the little advocacy where it's at the micro level, and it's about self and others, right? It also refers to a person's ability to effectively communicate their needs and their rights. And as you can see, I have pictures over here where you're talking about like maybe going to the doctor, right? And advocating for your own right in terms of what's the well-being of yourself. The doctor kind of puts on, well, you might want to take this medication. Well, do I really need it? Is there anything else I can do that's natural, that's going to help me address this particular condition that you're saying I'm having? Or must I always take medication? And if so, for how long? So the opportunity to ask those questions and advocate on your own behalf versus saying, well, doc, you got the degree hanging on the wall, you know best, give me what you got. And the importance of understanding our own rights to have questions for ourselves so that we can be best stewards of making those decisions for ourselves, right? And then even on the other behalf of just kind of saying, do you do this with all of your patients? Is this an opportunity to kind of take a look at your standard practices to change them so that our patients have other opportunities with all different alternatives? And so that's really something that you're managing that's going to help not only you, but maybe that doctor's practice internally, right? And then when we talk about big advocacy, we're talking about the larger scale and involves changes in policies and it impacts everyone's lives. And I use these examples and I really smile when I do this because I love talking with young people about big advocacy. And even some of us in the room, because one of the things that we know is that we in the United States have done a really good job about smoking policies in terms of in places and spaces like in restaurants, right? I would tell young people, there's a time that you could smoke in the airplane and they're like, no, miss, no, that's not possible. Like, oh yeah, There was a time that you could smoke in the airplanes, in the doctor's offices. You could, go to the store and give a note to the clerk, and you could be 10 years old and they would give you those cigarettes so long as it was signed by your parents in some spaces and places. They find this unfathomable, but then I have them take the time to Google it and research it. But I do that as a perspective of just kind of saying we've come a long way as it relates to what we've done with policies around smoking, but it resulted from advocacy. It resulted from people reporting about the dangers of smoking, not only for the individual, but also the public, right? And so from an environmental perspective, there began policy changes about smoking in different spaces and places, right? To help reduce the likelihood of somebody having secondhand smoke or somebody being exposed to it, right? And then the other thing I also mentioned too is, since we're talking about, underage drinking, that there was a period of time in our history where states were some places it was 16 years old to drink, some places it was 18 years old to drink, and then some places it was 21. But again, through advocacy, there became a federal standard that it says now you have to be 21 to possess and drink and use alcohol, right? And so just talking about the trajectory of our history of just basically giving illustration to say that when there's advocacy promoting information, talking about data, which we'll talk about in a little bit, but through advocacy and sharing and communication, policy can erupt. Right? Policy can create changes for the better that affects everyone. I took my examples in talking about tobacco and alcohol. Does anyone else have any examples, maybe even here locally, in the statewide or even in communities, that there has been a policy change that you've seen and it's resulted from advocacy?
I would say something that
Yes.
that I've seen in my lifetime is family bathrooms. There weren't those family bathrooms, and I think that I haven't done the research, but nowadays there's an assumption about the necessity of a family bathroom. But there are a lot of different individuals, whether it be individuals with physical disabilities, and you go into a bathroom and there's one, stall, and it's like, okay, but there's two people. So, and then obviously parents and now individuals who have concerns about identity and which bathroom they'll feel the most comfortable in. So I think that just for me is one thing that I was just thinking, okay, what was then and what wasn't then and is now. And so that was something that I thought about.
Yes. Right. And so there was a policy change as it relates to having family restrooms available for families that can go in. Mom can, there's a change table. Mom can change the baby's diaper, and there's not two people in that stall. And perhaps it's giving space and for occupying, right? What could otherwise been a long wait, because now mom has to change the diaper. Now mom has a safe space to do that, right? Anyone else? Yes.
I worked at KDHE previous to my current position, and one thing that research continually supports is doula for giving birth and positive birth outcomes if a doula is present. So last year, that became a reimbursable service for Medicaid here because of advocacy around that.
Absolutely. Absolutely. And then how about even in your communities? At least in my community, there seems to be an uprise in the number of ramps on the street. Like every block now has to have a ramp for accessibility for people in wheelchairs, right? So again, through advocacy of just kind of saying, everybody should have access to safe sidewalks, right? And no one should have to have their chair or motor scooter in the street to get from point A to point B, right? So we know that through advocating for a different cause or, different policies, right, can really be beneficial for our communities. Thank you. And so it's important to understand that advocacy does not endorse or oppose specific legislation, but rather informs the community at large how the public policy decision impacts service provision, right? And so I think it's important that we understand when we're advocating for something, we're really providing information that otherwise may not be brought forward without your doing so. And it's not necessarily lobbying. And so I just have a couple slides that talk about the difference between advocacy and lobbying. I think I'm going the right way. Yes. Right. There's a difference between advocacy and lobbying. I guess I have to add the pointer to here. Maybe. Okay. So lobbying is about seeking to influence or attempt to influence a legislation action or non-action through oral or written communication or an attempt to obtain the goodwill of a member or the employee of the legislature. So when you're lobbying, you're really asking for them to vote one way or the other. That's just going in with the ask. And they have lobbyists that do that. But when we're talking about coalition work, we're really talking about advocating in terms of sharing information. This might be a little difficult to see on the screen. So I'm just going to kind of point out a couple differences between advocacy and lobbying. So advocacy refers to attempts to bring positive change. Lobbying refers to attempts to influence the decision or actions of our politicians, right? So that's the difference of fostering communication versus just saying, this is what I want you to do. Advocacy involves raising awareness and informing the public about an idea, cause, or policy through by researching solutions and creating coalitions of like-minded people to do that, versus policy involves contacting or getting the public to contact the policymaker regarding a certain legislation. Okay? And then here's some examples. Advocacy is about educating an elected government official on the effects of a policy in your community. Because sometimes, I often say this, that politicians don't have all of the information, right? They're sharing, they're in conference and they're hearing about something, but they don't necessarily have all the information. That's where advocacy comes in. Versus lobbying is asking an elected government official to vote for or against and introduce legislation. And that's it. Like, we give you a lot of money and we put you in office and this is what we want you to do for us. And that's lobbying. It's about looking at that legislation and determining whether that is good for this group or not good for this group. Versus advocacy, like I said, is about providing them education so that they can make the best informed decisions on behalf of the community that they're serving. So policy change is effective when large groups of people can be reached through policy. Again, when we're talking about legislation and the enacting of legislation, it usually affects everybody, right? If there is a new policy, again, I go back to medical marijuana, right? If that legislation is being talked about and it's actually passed, then they have to define what that means and how people can access it, where they can access it, how much they can access, what times they can access. Do they have storefronts that have, state permission, all of those things, right? And that information needs to get out into the community. And I'll just share a little tidbit with you regarding Pennsylvania, because Pennsylvania didn't have medical marijuana until 2018. And when they had passed it, they gave certain conditions. And then they informed the public that there would be certain marijuana dispensaries. Each county or selected counties would have a number of dispensaries where this could be purchased. It was a recommendation, all right? And so you had to pay for it. A person had to pay for it. But they didn't do a really great job at giving that information because people who had a medical marijuana card often thought that they had a prescription. And what we told people is you don't have a prescription. And what we do is when we do a class about this is we share with them what a prescription looks like. It usually has a DEA number that gives you what the prescription is, what the amount is, if there are refills. A recommendation is just that. Here's a library, it looks like a library card and just says you have the right to have access to medical marijuana. And so they didn't do a really good job about that. And people were getting cited for possession of marijuana, despite the fact that they had a medical marijuana card. And so then when they came to our class, we had to share with them what that actually means, what it means to be in possession of medical marijuana and how it has to be packaged, how you can't just be out there using it publicly and which conditions that it came in, right? And so that's where it began to talk about, when you talk about policy, is oftentimes letting our legislators know there has to be some specific information around how that policy is going to be enacted and when, right? And by whom, right? And so talking about how do we change that for the better? So people tend to change behaviors when there's a consequence for not changing, right? And so in terms of this case, when you had medical marijuana and you were using it publicly, there were citations. And that's because of the lack of information. But once they got informed, those citations are kind of decreasing now. Policies are most effective when they're clear and understandable. So everybody's on the same page and they understand what that is. They're easy to comply with, right? And the public input went into creating them and they are enforceable. So we know that sometimes, even in our communities, there are policies that are on the books, but they're not enforced. Do anybody have any example of here in Topeka or about that there are policies locally that are on the books that you know of, but they're not being enforced? I know in our community, we have curfews. If you are in school age, you cannot be on the streets during the school nights after 10 o'clock. Nobody knows about that unless you're looking at the books. Now, I happen to know that because the mayor tells us that, right? Our local DA tells us that. We're in a coalition, but wide and large, the rest of the community doesn't know that. And they're really surprised. Kids are really surprised when you say, do you know there's a curfew law? They're like, no, there's no curfew law. Yes, there is. It's just not being enforced. So we always say, what good does it have to put it in the books if you're not going to enforce it? Right. But again, that's about educating and it's about raising awareness. And so sometimes taking a look at what's in our community and saying, how come that's in effect? Looking at our laws to say it needs to be updated or it needs to be changed or something, because now through that education, what's happening as a result of those two handicap spaces and people not having access to them because they're being occupied otherwise. Right. And so things of that nature, again, sometimes there are things that are in place in our communities and they reflected a time that it was most appropriate. But now we're in 2025 and we need to change. We need to change, take a look at, and that's something that young people can do in terms of research, right? Taking a look at what's important to you. How did it come into being? And is it still valid today? Do we need to change it a little bit? Right. And so these are where policy changes could be effective through advocacy. And so along with big advocacy and little advocacy efforts, there are big policies and little policies. And so let's start with the big policies. Let's start with the little policies, where little policies are really those that are informal agreements, right? They usually can happen at the local level, even within families, right? We talked about curfew, right? How many have children where you have a curfew instituted for them, right? And that's a family standard policy. Like, you know what the rules are. It's a rule, right? And they could also be group bylaws, such as in a coalition. How do we function? How do we relate to each other? How do we communicate, right? And they could be neighborhood rules, right? Sometimes within neighborhood rules, particularly if they're like cul-de-sacs, right? We have HOV coming in and say, you can't have your bushes at that level, right? We know that there are little policies. They're not actually laws, but they usually have no teeth to enforce, but they are specific to that group that decides on them, that agrees to them, right? And they can be policies. Big policies, however, are a little bit bigger because they're government. They could be at the government level. There are school rules and regulations. There are corporate policies, agency policies that are usually enforced, right? And if people aren't following them, most times there is some consequence that's attached to them, whether it's monetary or whether it's other punitive measures, right? But we know that there are big policies that are usually enacted in our communities that helps people kind of understand what the standard of getting along in our communities means. You know, imagine if there were no stop signs or stop lights, right? Imagine if there were, no parking. I was talking to Russell about parking, remember? Imagine if there were no parking meters or anything like that, right? And so we know that there are policies that are in place that says this is kind of how you will conduct yourself so that everybody can get along peaceably. And so when we're talking about, and I like to just kind of talk about what's happening locally, because oftentimes we think about policy that's a broad change, but we can start enacting things locally that can kind of garner steam at a local level and be enacted a little bit more quicker. We're talking about big policies, government policies. We know that those things take time, and they take some time too locally, but they can act a little bit on a broader scale, a little quicker. And so I kind of use this oftentimes talking about underage drinking, and just to kind of give you a brief synopsis, I go through understanding why there's underage drinking in different communities. And it's usually because what we call root causes or risk factors, such as availability. But then how do we change that so that there's no longer availability in our local level, right? And so for some people, it's kind of talking about looking at the density of the outlets, right? Sometimes it takes a look at the space and place in which we live, right? People do a what we call an environmental scan to see how is this impactful? Are there other local outlets that sell alcohol within a small radius, right? And oh, by the way, not only there's a density of alcohol sales, but people aren't carding. So sales clerks aren't carding either. So it's leading then to young people getting access to alcohol. And how can we change that? So one of the things that can happen is that we take a look at the policy. What is the policy about the plentifulness of alcohol in our communities? And can we do anything to affect change around that, with policy in terms of that local condition? And currently there are 12 low-price alcohol outlets concentrated in your community. That's information that our policy leaders need to have to perhaps make that change. Particularly when you can say, as a result of that, this is what's happening among our young people. That information through data can help change that outlook so that you have less likely the number of alcohol outlets, right? Because they have to be licensed, at least in our state, they have to be licensed to be in existence. And you're doing a good job of saying we're not going to be giving that many licensure in that community based on the density. We're trying to limit or decrease the number of outlets that have alcohol. And that's through advocacy and information, right? And in that advocacy, you have coalitions and groups working together to say, we need to do something about this. We need to create that change in our communities to make that less likely to happen. And so in the neighborhood itself, the little P is neighborhood agreement not to purchase alcohol at groceries or many marts that have been cited for underage. So that's something that the community can do. We're going to take money out of your cash registers by saying the work that you're doing, we're not okay with. And to show you how we're not okay with, we're going to be in agreement not to purchase at your establishments. That's less revenue coming in for you. That's less, you might be not able to pay bills, right? So that's the one thing that we're going to do. Outlets revisiting and improving their train, unless maybe you might want to train your clerks on how to do appropriate IDing. Maybe you want to do a little bit better about moving alcohol out of the way so youth can't get access to it. And so those are some of the things when you think about locally what's happening. I'm not certain if you're having a resurgence in some communities of vape shops, right? If you have a resurgence of, let's use vape shops. Is that happening in your community? It seems to be. And when you're finding that, what's been the outcome of that? Are more and more young people accessing vapes and using the vapes? And so looking at the policy, what is the local ordinance around that? Because some places, vape shops are just showing up. Like particularly if there's no ordinance about that. They're just starting these mom and pop places because they know that they can. They're paying for that rental space, they're opening it up, and they may even be prescribing that they're having, candy sales and that type of thing as their main product. But they're also then now behind the cash register, they now have some vape. And so what is it that a community can do about that in terms of looking at that environmental scan is finding out locally, what is the law about that? Is there something on the books that say there can only be X number of vape shops within a square mile radius? And if so, is that being enforced? And what I will say to you is I know that vape has hit the scene in such a way that sometimes policymakers aren't understanding and sure how to respond to it, right? They're not prepared. And so your due diligence as coalition members can be to help them do some of that homework and to bring to them some of that information to say, did you know? And if there isn't policy, then we need to enact some policy pretty quickly. But what can we do in the meantime in terms of practices, right? And in some communities, what they will do is they will let people know that this place over here is providing vapes to young people under the age of 18 or 21 or whatever that age is, right? And so it's kind of setting off information to say, we need to kind of frown upon that place and don't go and buy anything from there, right? Or if if there are laws in the books and it's not being enforced, letting law enforcement know. I was sharing with somebody earlier that on our coalition for opioids, as part of the subcommittee, we also have the district attorney on our committee and just relaying information to him. And what he says is I'll have one of my guys go check it out. And so we have been successful at having some of those vape shops actually being closed. Now, it doesn't prohibit others from popping up somewhere, but kind of keeping your eye out in the community about what's happening and being able to communicate that to some folks that could create that change pretty quickly. So I'm hoping you kind of understand is that sometimes people, have the idea to say, it's been that way, it's always been that way, and it's never going to change. And I say through the work that we do as coalition efforts, we can create that change. We can realize the change, and we can see it, and we can make it happen. And it's just about being able to do our due diligence in terms of understanding what policies or laws are in place, how are they affecting our community, and then how do we transmit that information so that change can happen. Any thoughts, any questions, any ideas about some other policies in your community or some of the things that you're seeing in the way of happening for young people that could perhaps your group can take a look at or groups can take a look at to say, how can we change that? All right. We'll move on and maybe you'll have some other information for me. That's okay. And so big policies usually increase sanctions on those owners, right, for underage drinking. Also can remove their license, right? And we've seen that happen too. We've seen actual beer distributors close down and lose their license to sell for the infractions. And then the city ordinance, like I said, limiting the density of outlets. And then there could be even others. One of the things that sometimes is a bold move is putting citations, much like they do in our community. We get a list in our newspaper of restaurants that have been cited for violations, and they've actually given what that violation was, right? And so it's kind of a wall of shame, if you will, for lack of a better word, but it really does encourage then that those folks that have where they're selling food do a little bit better job because they're random visits by the it's not the FDA, it's food inspectors. Thank you. Yeah, it's the state food inspectors. They go in, and if they're finding different things that are wrong, some people don't, everything from there's not a clean beverage machine or something like that. That hasn't been cleaned. That's put in the paper. And so people are less likely to go visit those restaurants, which can hurt their business. So the next time they come around, though, if there's been some improvement, that's also cited. And I share that to say in the same vein that if there's really a concern about the number of density of outlets and the selling to underage drinking, youth, that can be publicized. And so helps the owner to realize that the community cares about this and that we need to do something differently in terms of our practices. So how do we push for policy change? We do so by engaging in advocacy, right? We need to support a cause and persuade others to change the rules, policies, or laws through their awareness and education, which is something that you're going to be doing tomorrow, right? You're going to be giving testimony to support of the general cause, i.e. drug prevention. What is it that, understanding that in your information, what is it specifically that you want them to know so that they can take the appropriate action on? Provide technical assistance or advice to lawmakers upon written requests. So sometimes lawmakers say they want to help through policy change. They want to help draft and create a law, but they don't know how. And so coalitions can be very effective in terms of starting and creating that policy change. They want to generate media buzz about the cause. And so we'll talk about that. How do you do that? Which mediums are most appropriate to generate that stir and creation of information? And then inform the public how public policy decisions impact the community well-being. As I said, you are spokespeople for helping others understand what the laws are and what they mean. Oftentimes, people kind of meander about their day-to-day, and they may not have the awareness. Our legislators don't necessarily have the awareness, but usually the common folks that aren't involved in coalition work don't have that awareness as well. And so that's why it's important that we create, those not focus groups, but we create opportunities through outreach and education and awareness workshops or sessions or whatever you want to call them to the community so that they understand what does the passing of that legislation mean, or what does the inaction of a legislation mean, and how we can help to create and affect that change. And so understanding that advocacy has a really critical piece to helping to introduce and create policy. We want to avoid voters. We want to avoid encouraging voters how to vote at the voting booth, right? That's not what we're asked to do. We want to avoid endorsing a specific piece of legislation as well as oppose a specific piece of legislation. It really is about providing information education so that policyholders are best able to make that decision about what should be passed and what shouldn't be. And so, again, we're not lobbying, we're advocating. And all of these can be done by private citizens, right? But make sure that you're not using your public funding to do that. Next. All right, and then I go too far. All right, let's back it up. Make sure, can policy ever backfire? Sure. And I apologize for when I sent the PowerPoint, it kind of jimmied up some of the language, but I just wanted to let you know they are not thought through before implementation. So sometimes people say, well, we should just do this. Like I was talking to you about Pennsylvania and our medical marijuana. It wasn't really thought through. Oftentimes, and we've been very forthcoming in Pennsylvania when we were able to get before our legislators, is that you thought you were looking at what other states were doing and how they were benefiting from it in terms of the revenue. And so you wanted to enact something fairly quickly, but you didn't do your whole due diligence in terms of that medical marijuana enacting. And so it went through without a whole lot of really forethought. And so now questions are coming back. Like, how do we handle this in these instances? We want to make sure that sometimes it can backfire because the well-funded opposition is able to create AstroTurf protests. And so, again, and I keep thinking about marijuana because this is now the landscape. This is being pushed forward in a lot of different spaces and places and states about medical marijuana and even recreational marijuana. And you have lobbyists that are in your legislature every day talking about why they should make that push, talking about what the revenue can look like and how it can benefit people, et cetera, et cetera. So you have a groundswell of saying, while we're saying we want to be careful about the dangers of marijuana, particularly in the hands and minds of our young people, there are some folks that aren't giving thought to that and are really just pushing for the push because it can end up becoming a moneymaker in every state's revenue. And that's really what they're kind of hanging their hat on. So we want to make sure the opposition, they have their information, but we have ours as well. And then too many people truly believe their constitutional rights are being limited. So some folks feel like they don't have the right to speak up and speak out. Some people feel like it's been this way, that I put this person in a in a political position to make the best decisions for me. I'm done. My role is done. I clicked the vote. That's it for me. I don't need to do anything else. And so they believe that constitutionally speaking, that was their right, their privilege, and they satisfied that, and they don't have to do anything else. And so now they don't do anything else because that's all they were supposed to do. And this is why it's even more important that as community members, as community leaders, we are informed about the process of advocacy and how advocacy can really be instrumental in creating policy that can lead to change.
What's an asterisk?
Well, it's just like that. It's you get a bunch of people. Let me see if I can. I watch a lot of Law and Order, so I just kind of think about, how when people are going to the courthouse and you have all these people like saying, there was one scenario where I saw for a person, New York doesn't have the death penalty, but in this case, in this story, they wanted this person to actually face the death penalty. But you had a lot of people out there saying, no, this is a Constitution, it's against the Constitution, do not kill this person. So you basically have groups of groundswell of people that are really in a different space and place, maybe at the Capitol, maybe, in DC or whatever, like really groundswell saying we need to do this. This isn't right, or this is right, and we need to be for it. So that groundswell is either before something or against something. But it's just an astroturf is kind of like that loose way of saying it's a groundswell of people that are involved in that protest. Yeah.
Not necessarily planned out or
it can be spontaneous. It can be planned though too. It could be both. But what the result is, you end up all of a sudden there's a group of people, right, outside City Hall or outside the Capitol building or outside someplace where they're bringing attention to themselves. Yeah, that's a great question. Any thoughts? How are we doing with time? Okay, great. So now we're going to get into some places and spaces where you're actually going to be kind of doing some writing, some conversation. Like I said, you didn't think I was going to do all the talking, did you? That doesn't happen with my trainees. So we want to talk about how law becomes a bill. So it's important that you understand that in Kansas, the legislature consists of two houses, the House of Representatives and the Senate. And either house can bring forward a bill, right? And then just in terms of the structure, and I think I had a handout. Let me see if it's in this paper here.
You do.
Yes. So there's a handout. You all have a handout. And it just really gives you the opportunity of understanding how a law starts either in the House of Representatives or the Senate, but what's that process, right? Usually a member of the legislature introduces the bill. The bill is signed to a committee for review. So they're looking at the particulars of the information, right? To say, yes, this should be carried forward, or no, it shouldn't. What are the pros and cons? Why are we doing this? Why aren't we doing this? What has been? Have we had anything like this before? Is there anything similar? There's that conversation at the committee. So it's debated, and it's really voted on the floor whether it gets carried forward or whether it gets crushed, right? And then the bill is referred to the other chamber if it passes for more discussion to occur, either in the House or the Senate, whichever didn't bring it forth yet. And then the bill is sent to the governor if it's passed. So having said that, now we have a little bit more information about advocacy and a little bit more information about policy. I really wanted to offer a time to just kind of say, you're in this position now where you're going to be strategizing, right? Where you're going to be looking at how are you bringing this information forward in the way of informing our legislators and what we need to do. And it really is talking about advocacy being actionable. And if we're going to take action, there are certain things that we should be thinking about doing, right? And so it gets into identifying what that strategy looks like. So it's important. And I was asking about the information because, and you'll hear a little bit later more about data, but data is really important, right? Data provides credibility to making your case for that community change. Without data, we're kind of just supposing some things, but when you have hard and fast facts, you can't really argue with data, right? data can be done as it relates to quantitative or qualitative data, right? Quantitative data, everybody's familiar with these, right? Everybody's done some semblance of quantitative data. Can you tell me what quantitative data you've used recently or ever as part of your work? Suicide rates, perfect, perfect. And so you're able to kind of share over a period of time, right? The number of suicide rates and if they've gone up. Perfect. Perfect, perfect. And the other comparison that you can make, even in terms of the national model. So we've done, right, in our community, we've done both from state, county to county, but we've also said in terms of the national. It can really paint and tell a story about what's happening. And even in terms of like looking at gender versus race versus age. And I love what you talked about in terms of talking about geographics, because is there part of the state where it's happening more readily? And what might be contributing to that? Absolutely. Thank you. Awesome. Awesome. That's great. That's great. That's great. We have, I mentioned our opioid coalition, and we actually have our coroner, our head coroner who's on our coalition as well. And then one of the things that you have the opportunity to even do is when you're talking about suicide, because I asked the question, they give data about suicide, but they also give data about overdoses. And we were concerned because we have a fatality review. And I said, how do you know those who are overdosing, how do you know they weren't trying to harm themselves, fatality? And the answer that I got was they really weren't sure, unless there's a conversation and we're trying to get to that where families feel comfortable talking about that. But that's, yeah, absolutely. Great work, great work. Any others? So we have some folks that are going to be talking with their legislators about suicide, the rates of suicide in their communities. And what's also opportunistic for you is to let your legislators know, leave behind that one pager, leave a contact. I'm probably giving you more, we're going to be talking about this, but leave a contact because they may want to have a follow-up as well as yourself to have this information. Because again, as I mentioned, legislators are oftentimes not necessarily knowledgeable about what's happening within your specific local areas. They take a broad stroke based on state information, but locally what's happening is they depend on you for that information. So that's excellent, wonderful. And then, so we talked about quantitative data and talking about the different pockets of where we can get quantitative data, but there's also qualitative data, right? And so qualitative data really is about painting the picture, telling the story. And the qualitative data means you're basically getting it from maybe focus groups, right? Or key informant sessions, right? When we talk about the work of the coalition, right? It's much outside in what we do in the community as much as what we do inside for ourselves, right? And that qualitative data can really kind of think about how we framework that and how do we get information from the community at large to talk about reflection of community concerns, right? And so I just kind of had an example when we talk about quantitative data, like I mentioned student surveys, and you guys share with me the information around that. But is there opportunity for parent surveys, right? So sometimes those of you that are in programs, right, is there opportunity to get information and feedback about from parents in terms of what their input is about how they see, the value of the work that you're doing from a programmatic perspective, and getting parents to give you some information through surveys. The other thing is about community surveys. Is there opportunity to get a survey for the community about it's the pulse of the community based on health and wellness? And I know sometimes identifying what other institutions or entities do these surveys, like in our community, we have hospitals and the United Way. They do surveys with adults through sending it out through the mail or, giving them a link through the internet, asking them to do a survey regarding what do they think about the wealth and status and well-being of our communities. as it relates to violence, as it relates to homelessness, as it relates to teens engagement and unhealthy behaviors. There's several different categories. And then they give an incentive, like if you complete this survey, they get like a coffee coupon or something like that. But again, it's another space and place to kind of get some data from other from outside of the coalition that you can think about using and sharing that, right? And collectively putting your information together, right? And so there's existing data from law enforcement as well, depending upon what you're looking at. I mentioned the coroner had information about overdoses and about suicides. The law enforcement might have information about arrests, right? Maybe about, if there's talking about underage drinking, about the number of arrests for underage drinking, or the hospitals for accidents or something of that nature. But just offering the idea of just kind of saying there's a lot of data that exists in your community, and having a matter of knowing who has it, where you can find it. Some of this data is public information. And just how do you communicate with those places and spaces to say, can you give us information? 9 times out of 10, they're more than happy to share that information with you. And then you might be able to share something that you have with them as a means of exchange of information. That's wonderful. And then, our health department has data information that we could utilize, as well as our law enforcement, right? So we know that there is data in our communities. It's a matter of understanding what's the information that we're looking for, what data do we need, and who has it. And sometimes more than one entity will have that information as well. Awesome.
There's a new, just I don't know if people are aware of it, there's a new site called All Things Kansas that K-State has put out that has like all kinds of things.
Who sponsors that?
Well, it's housed at our Kansas State University, K-State EDU, and it's an interactive tool. It has mapping reports inside. DJ, have you seen it yet? Yeah. So it has a lot of different stuff on it. That might be something to check out too. Have you looked at it much yet?
I looked at maps.
What's it called again?
So All Things Kansas. That's pretty cool. That's pretty cool. A lot of data. And so then I also have other qualitative data that you might be able to do, like individual interviews. Now those take time, but they're actually worthy of information. Individual interviews can be very beneficial in terms of finding out what's happening in terms of from a personal perspective, but also sometimes they can be reflective of things that are happening among other folks in groups that way. There's also qualitative surveys in terms of what do you think, what's your perceptions, right? Focus group discussions that you can have around a certain topic, right? About what's happening in the community. Record keeping, that's really coming from a space and place of data driven. We have at our county, there is like an information system of data that comes through our county regarding different things. And that person is the keeper of all that information. Number of 911 calls, number of overdoses, number of arrests from the county perspective, and where specifically in that county. That we have an information system that gives us that. And then there are case studies. Sometimes case studies can evolve that can give you some information based on that, and then observations. We usually call those like environmental scans or community assessments. What are we seeing? What behavior do we see identifying, and where is that behavior occurring? And so those observations. I share that to say that all of that data, whether it's quantitative or qualitative, can really give you a perspective of what's the story that you're wanting to tell based on that data. And then through that data, we want to create awareness, right? Sometimes it's important that we tell the story that we've come up with. And how do we tell that story? When do we tell that story? In what capacity do we tell that story? Is it done in forums? Is it done as part of a communications, right? Through a lunch and learn, right? Through a breakfast, right? These things that you can have with your legislators. We sometimes have legislative breakfasts, and we bring them up to date and up to speed on what current event that we're working on and where are we with the status of things. The lunch and learns might be giving information to key stakeholders and asking them to take it back to their different areas of expertise and where they work and play and pray and those type of things. But the important thing is we're not just holding on to that information. And that's sometimes to the demise of groups and coalitions that I've seen. It's like they've done a yeoman's job at getting all this information, collecting a lot of information, and it sits on a shelf and collects dust. And it doesn't do anybody any good to have it collecting on the shelf, right? We need to be able to do something with it. And through telling that, through results, giving out those results, right? Sharing them with other folks. That means we have a more informed community when we can share that information. So creating that awareness is very, very important of what our data tells us. I even have some school districts that they do our student data, but they don't do anything with it. And it's kind of pulling teeth to get that data. They want to keep it to themselves because they want to paint the picture that all is well in school district A, B, and C, that there are no problems. And meanwhile, we have a number of suicides from that particular school district. We ask them, do you have therapists? They don't have a school therapist. They might contract with them out, but there's nobody that's on staff. They don't want to participate in our student assistant programs, none of those things, because they want to portray the picture that all is well in district ABC. But we know that their student data is telling something else. Or we have families that contact us to say, can you help us put together a parent forum to talk about something? But creating that awareness can be very beneficial. And what you do is you give them the information that's saying, I care about my backyard. Because you're absolutely right. The national, we know, nationally speaking, whatever. But when we can talk about what's happening in our backyard, and we're talking about it from a perspective of not only that quantitative data, but that qualitative data, we can see it. We can see it, we can refer to it, we can touch it, we know it like we know the back of our hand. That's really where you get the attention, right? We're going to talk about also how do we tell our story about that through actual pieces of what's impacted families and how it's impacted families, right? So here's the question, and what I'm hoping that we would do is spend the next hour, right, kind of really crafting and taking a look at developing a one-pager. I know some of you have one, but for those that don't, and maybe just a reinforcement of how do we create that one-pager, right? And what should it contain? What should it look like? But the other thing that we want to do is talk about when we're thinking about whether it's suicide, whether it's overdose, whether it's vape, marijuana, what have you, kind of think about, and let me hear from a couple of you, who else might be interested in this and why? Who else might be interested in vaping among youth or suicide, marijuana, the medical legalization of marijuana? Who else would be interested in this cause or problem and why? Who else outside of this room? Who else when you think about your communities, who else would be interested and why?
Primary caregivers or
caregivers, like
doctors.
Doctors, okay. Why would they be interested? Maybe.
I think a lot of times they're frontline when it comes to people who are reaching out for help, because a lot of times physical health is what we think of, even if it may be a mental health issue. And so maybe they'll see that first, but not necessarily know how to respond. And so it's better for them to be aware. That way they can point that person in the right direction.
Thank you. Yeah. So primary caregivers like doctors, like the medical profession might be interested, right? Maybe they don't have a practice of when they do assessments. You know, long time ago, we talked about tobacco earlier, when we began to think about policies for tobacco, they began to ask that question, do you smoke? Before that, they weren't asking that. but now as part of the, let's take a look at what's going on with you, and could smoking be contributing to your respiratory or your chronic colds or something of that nature? Now they're asking that as part of the assessment. And so if they're understanding that there is an uptick in the number of folks who are perhaps hurting themselves through suicide, one of the questions they could be asking is, do you feel safe at home? Or do you feel like you're going to hurt yourself or something of that nature? And what happens is people automatically formulate some type of trust in the doctor because they're going to them. They say, Doc, what's up with me? What's going on with me? And so through those casual conversations, they might be willing to disclose to the doctor something that they might not disclose to other folks. So thank you for that. So we know that doctors need to be informed. And we share about these different, what I'm going to call sectors of our community, because we know that everybody should be concerned about in some form or fashion. And sometimes it's our responsibility, right, as coalition members, as key stakeholders in our community, to even share why would they be invested and why would they be interested. You know, some other folks that we might, I often talk to is our business folks, right? If there's a element of violence in the community, businesses might want to know about that. Or if there's problems happening with young people, and you're going to be entertaining hiring our young people, don't you want to know that they're coming in, they're not under the influence, right? And that they're making good, sound decisions for your business as well as for their own wellness. And so understanding that this is a problem that should affect everybody in our community. So one of the things that we want to think about then is, with those folks, how do we generate their engagement, right? How do we generate their engagement? So there's an opportunity to talk to them from a perspective of what's in it for them. Why would they need to know about the status of medical marijuana bill? Why would they need to know about the number of overdoses? Why would they need to know about the number of suicides, et cetera, et cetera, et cetera? And what means by which they need to have that information, right? And if we're talking about sharing this information to the public, sometimes, depending upon the individual, there's certain information that might be specific for them, right? So in generating that engagement, how do we generate the engagement with those sectors, right? How would we speak to parents, and what forum that we could speak to parents so that they're concerned about, they're interested, they're focused, and they're concerned about the problem behavior. And then the other thing is telling the story, right? And so oftentimes, usually when I do trainings, one of the things I like to do at the beginning is to ask people to think about, what's your why? Why do you engage in this work? What is your reason for sustaining the longevity of the work that you're doing? What is your why? And usually I have people talk about it at their tables. Usually I might have people paired up, or sometimes when I'm feeling really robust, is I make people get up and talk to somebody they don't know, which is like, oh my God, I gotta go talk to somebody. But it's really an opportunity to do two things: network and meet other people, but also to exchange information, right? And so talking about what your why is really part of your story. What investment, what interests you about suicide that you feel so compelled, so passionate to share that with your stakeholders? And I share about telling your story because from the story resonates within. It talks about why that is meaningful for you, and you transcend it in a way that it connects with your local leader, right? And they hear it. They hear it because they hear it from you, within you. So talking about your story, everyone has one, right? You're talking about this work, everybody has a story, which brings them to prevention, right? You're talking about suicide or opioid overdose, everybody has a story. And so helping them understand what your story is, right? So I'm just wondering, now that I've kind of prefaced all that, like, if you were to share that story with somebody, what would you say? And then the other thing is, as we're generating our story and determining who we're telling it to and what are we going to tell them, is say, how do we do that? Right now, tomorrow, folks will be face to face right, with your local legislators. And so, but is there other ways, understanding that there are other ways in which you can generate your story. So about 1 in 5 US adults say that they get their political news primarily from the social media, right? So in doing that, the social media, we know that face-to-face can be very informative, can be very impactful, but we also know that sometimes the other media, such as, we watch TV, I love Good Morning America and some of the information they have, and I kind of take that in and take that to heart and kind of get that aha moment. But we also know through written, right? There's the local newspaper. It might be in written form, or could be online, but there's another medium that we get the information. And then we also see a lot on, Facebook, Instagram, Twitter, even our LinkedIn accounts. And so oftentimes coalitions think about how do we transcend information. It's usually we took 1 or 2 mediums, but I say what's prohibiting us from taking all different mediums and saying this is our delivery of information, right? And so tomorrow you'll be able to be across the table from your legislator or your representative, but then being able to follow up. And so if there's information that you can continue to send to them that really supports your information, maybe newspaper clippings or radio, or well, not radio, but other internet or, means that you can kind of share with them. And if they do listen to the radio, perhaps they'll hear it being reinforced, right? So just kind of thinking about what is the right media outlet, right? And so I just say, let's not limit ourselves to just one, but let's think about every avenue. I would be remiss if I don't share my little thought about our work as coalition members or as key stakeholders. We think about this in the manner of how do we help people? And I got to tell you, businesses think about it in the same way. And so I in turn think sometimes we have to think like businesses, right? We think about McDonald's. McDonald's spares no mechanism about how they get information out about their Big Mac, whether it's the radio, billboard, whatever. And so why aren't we doing those things? Nike spares no business, they think, and so we may not have their pockets in terms of funding, but we certainly can do things our way, no pun intended, our way to transcend information out there into our communities and with our local legislators. And so following up with them, sending them news clippings, thanking them for hearing us, being able to be that conduit, that constant conduit, because maybe they would call upon us when it comes to particular legislation that they may say, we want your input on this, because we now understand that you have your pulse on the issue and you have a connector to the community. So now we're going to ask you to kind of try. We talked about vaping, we talked about suicide prevention, we talked about overdose, we talked about marijuana. So I'm just wondering, I have 4 different areas, so other social areas, that I'm wondering if you can think about the problem and its impact on the community. And if it's not an impact on your community, just kind of, for purposes of this exercise, kind of make it up, right? But I just kind of want you to get into the habit of thinking about creating a one-pager, that concise information describe what the problem is and how it's impacting the community, right? And then identify what is the cost related to that problem if it's not resolved, right? And then explain how a proposed policy could address that concern. What kind of, basically saying, what's the solution? How could we make this better for everybody so that it's no longer a problem? So as you can see, I have poverty, mental health, vaping, and access to healthcare. I chose those based on what the young people said, right? So I just want you to know Yvonne's not making stuff up. Okay, from a place. So this is basically just kind of saying, what is our message, right? Identifying the media targets, we talked about that. And how do we speak strategically? How do we speak in a way that they are receiving the information and being impacted? And then shaping the opinions of, we need to create a better, healthier Kansas. When we talk about it from a perspective of health and wealth and well-being and thriving, people tend to kind of be in agreement. I don't know anybody that says, and somebody said it earlier, I don't know anybody that says we don't want drug-free, healthy youth. Everybody's in agreement with that. And so how do we get there, right? I don't know anybody that would dispute we want a healthy Kansas. And how do we get there? And that's how we begin to be thinking about change. And then anticipate that maybe you'll get some feedback or some questions, but anticipate what might be those questions and be able to be responsive to them. And so you have a handout on the second page, just so that you know, this is covering 2 slides, but this is 1 pager, right? Tip sheet that will help you all. And I just kind of have that written there, meeting with your legislator or staff person to share your story and information. Give them a 1 pager, which a couple of you showed me. Make sure you leave that pager behind and let it be a brief fact sheet on a single page. Don't inundate them with too much information, 2 or 3 pages, because they're not going to read it. But if you give a 1 pager that's concise, that expresses the facts and probably helps with remedying the solution, they're going to be paying attention to it. And so those are just kind of the key points on that pager, right? Summary, what your legislator could do to help, like support prevention funding. If you could include a list of supporters, such as a group or co-sponsors, that's fine. And then include contact information to leave behind, so if they have any other additional questions. And then let them know that you will be following up. We thank you for your time. You'll follow up and later, the next day or 2 days later, send an email just saying, we want to just reinforce our time together. Thank you so much. And just want to let you know we're here. If you have any other information, there's some times that we might want to invite you out to our community, do maybe a little scan walk with us, but let's work on this together. And this was just a case statement I gave about, this was out of the Police Association, a police foundation, and how they kind of gave their bullets about the legalization of marijuana. And it was just kind of concise. The language that they had, they talked about the effects of it. They talked about the detriment that it can bring to the community, and why perhaps legalizing marijuana may not be in the best interest of public safety. I found that actually on doing some research on this. So I just thought that was kind of a neat, concise way. And then I just want to kind of share with you that at CADCA, we have an advocacy toolkit that talks about how to guide and educate legislators. And then being an advocate is an effective pathway for differentiating your thought leadership, right? So we talked at the beginning about leadership. And I just want to go back to that, of just kind of thinking about what type of leader are we? We are a resilient bunch of folks that really see the good in our communities, and we want others to see the good in our communities as well. And we know that it's not going to be easy, that we're going to be going in different directions sometimes, but when we stay the course and we are diligent and true to the goal, we will reach our outcome and celebrate for the good of our community. I hope you're as fired up as I am. I enjoyed myself. I want to thank you for listening. It reminds me that, you know, when I go back home, I get really rah-rah, and sometimes my coworkers say, well, you were in a training, weren't you? Absolutely, because I just see that we all have the opportunity to work together and build safe and drug-free communities within our communities that ultimately will reach our states, that ultimately will reach the world. And we are that special sauce, lettuce and cheese, and that pickle, onion on a sesame seed bun by the work that we do. Yeah? All right. Thank you. Thank you.